I want to say something that the research and continuing medical education unit started with my own self and Professor Okeahialam. And we used to have the kind of help for the research and continuing medical education unit. But over the years, that has since gone into extinction. But a short discussion I had with Professor Okeahialam some weeks back, and I think we're trying to see how we can coordinate lives with the coordinator so that we bring back the good old days. And then to able to refresh our memories, we can also bring back some old lectures. I remember very well the very first lecture delivered to us by Professor Okeahialam, Professor Ikeme, and then it was followed by another lecture by Professor J. Igiri. I still have those lectures with me, and I think we will be able to produce those lectures so that we can circulate around to the present generation so that they will know what was obtainable in the past. And I want to say that a lecture of this nature is not only topical, but it's very necessary for our present-day generation that we are in a recession. And also the state of the economy is such that we are not too sure of when we are going to get out of this recession. So we need to really organize ourselves in such a way that we do not stress ourselves to a level that will impair our productivity greatly. I want to thank the coordinator or the organizer of this lecture, and also to thank the coordinator of the Research and Continuing Medical Education Unit on whose energies this lecture is being organized. I also want to thank all of you that have found time to be here this afternoon for this lecture. I also want to place on record that I'm here with my own Reverend Thomas T. Lord. He's very passionate about sleep, and that is why he is here with us this afternoon in this hall to give us the spiritual backing. And of course, we also have our Professor Dango. He's also a pastor of the so we all belong to the same organization. So, my dear colleagues, I want to say thank you for the privilege of being here, and I say welcome to this lecture, and we look forward to more of such lectures that will help us to live here that none of us want to die from. So, thank you and God bless.
I have anything to do with sleep can come together and rub minds once in a while. Today is the World Sleep Day, a day set aside by the world attention to the importance of good sleep to mankind. It was first celebrated in 2008 under the slogan, "Sleep well, live fully awake." Sleep well, live fully awake. So if you sleep well, you are awake, and then things go well. In Igbo, when you're misbehaving, they'll ask you a mubanya. That means, are you sure you are awake? Because if you sleep well, you will be so awake, so organized, that things work out well. When you're disorganized, people wonder whether you're sleeping well. So sleep well, live fully awake. In 2008, that was the first sleep day. Subsequent themes are as follows. 2009, drive alert, arrive safely. Professor Koli talked about it. Accidents on the way. You will be surprised how many of them are because of drivers who haven't slept well during the night and hit the road in the morning. 2010, it was sleep well, stay healthy, lifestyle medicine. If you sleep well, you are likely to be healthy. In 2011, sleep well, grow healthy. For our children, very important. These days, ICT distractions. The children are on their WhatsApp, on their phones, on the TV till 11, 12. They are cutting down on sleep hours. They are not going to sleep well. Only God knows whether the restiveness we have in our youth is because they are not sleeping well. In 2012, breathe easily, sleep well. Professor Colley talked about that. 2013, good sleep, healthy aging. Dr. Madaki talked about it. How well you sleep determines how gracefully you will age or how turbulent your aging will be. In 2014, the theme was restful sleep, easy breathing, healthy body. 2015, when sleep is sound, health and happiness abound. In 2016, good sleep is a reachable dream. We just talked about dreaming here, so you can reach that dream of good sleep. And this year, it is sleep soundly, nurture life. Now, for this day, the World Sleep Society has issued a declaration, and I'm going to read the declaration as issued. Whereas sleepiness and sleeplessness constitute a global epidemic that threatens health and quality of life. Whereas much can be done to prevent and treat sleepiness and sleeplessness. Whereas professional and public awareness are the first steps to action. That is what we are doing. We are creating awareness. That is the first step to action. We hereby declare that the disorders of sleep are preventable and treatable medical conditions in every country of the world. So, on this year's theme, Sleep Well, Nurture Life, we need to ask the question, what does it mean to nurture? I went into the dictionary and I was told that to nurture means to care for or to encourage to grow. We'll keep this in mind as I go on with my talk, because it is only what you love that you care for. It is only what you love that you will tend to grow. So if you love your life, you have to sleep well. Now, if you sleep well, there is no problem. If you do not, you suffer insomnia. And when can it be said that an individual is suffering from insomnia? You have insomnia when you take more than 30 minutes to fall asleep. Dr. Madaki talked about going to bed, going to sleep. It's not all the time that we fall off to sleep as soon as we go to bed. There's a bedtime, there's a sleeping time. But if you take more than 30 minutes to fall asleep, if you wake more than 3 times during the night, we all wake up for various reasons. That's not the problem. But it is when you wake, how long do you take to go back to sleep? So, you take more than 30 minutes to fall asleep, you wake more than 3 hours during the night, you stay awake longer than 30 minutes in total before going back to bed, and these occur more than 3 times a week, more than 3 weeks a month, for at least 3 months of the year. Then we can say you have insomnia. Somebody talked about passing transient things that can cost us sleep. That doesn't mean you have insomnia. You have an exam tomorrow, promotion interview. You want to get to that rank before retirement so that your pension will be higher. There's no way you can go to sleep. But of course, if you can do what Dr. Madaki has advised, wake up, write down. Tomorrow I'm going for interview. I am going to meet Dr. Kashima, the CMA. I'm going to look him straight in the face and answer his questions. You will find that when you go back, you can sleep. But if you just lie there thrashing about, you may never be able to sleep. But that is for the period prior to the interview. And once it's over, you get back to sleep. If that is the situation, you don't have insomnia. You have to satisfy all these stages that I talked about before you can be said to suffer from insomnia. So, if nurturing life depends on sleeping well, then good sleep must serve useful functions, isn't it? Yeah. And what are some of these useful functions that good sleep will serve? 1, good sleep helps you to recover from the day's internal and external stresses. I woke up this morning excited, looking forward to showing you what our Me Too can do. I have come here exactly at 11:30 when we should start our light goes. DA has pulled the call to the generator house, we don't have light. I'm told that the gentleman said somebody has to come and eyeball the diesel before he can pour it in. He's been told, don't wait for that for today, go ahead. But of course, we are here, no light. Don't worry, it's my luck. You know, it happened to me during the lockdown. And I told them that I am not a teacher for nothing, that I will raise my voice and the audience will hear me. And that is what I hope is happening now. I don't have a public address system, and I hope I'm being heard as far as the back there. So you need to recover from internal and external stresses. Otherwise, you won't be ready for the next day. Now, this is necessary, otherwise we fatigue or burn out. If you don't sleep at the end of a day, when you have been buffeted on all sides, internal and external stresses, if it remains consistent, fatigue sets in, burnout sets in. But if you have good sleep at the end of every day, you recover and then you're ready to go. Good sleep helps us to focus attention and be sharper the next day. If you don't sleep well and come to work the next day, you are going to be irritable, unfriendly, you can't focus, you don't care what is happening. For those of us who work in a hospital environment, I tell people that many of us Can you come on? If you can, I will tell you the stage is there. Okay, they've gone again. This is the love. Okay, so we are sharper. We are sharper the next day. Sleep helps acquisition, retention of memory, and recall. If you don't sleep well, you won't acquire memory the next day. You won't retain memory. I told you about what happens between us and the medical students. You give your lecture. Do you understand? Yes, sir. Okay? You come to the ward. Who can define hypertension? They are looking at you. What has happened? They didn't acquire. And that's probably because they didn't sleep well the previous night. You acquire, you retain. Otherwise, it will be going in from one ear, going out through the other. So you have to retain, and then you have to be able to recall. So you acquire, you retain, and you can recall. Otherwise, you are no use to anybody. Good sleep helps you to grow and helps you to heal. Dr. Sai talked about anabolism. During the day, we are active, we are under stress. Free radicals are produced, they cause damage. When you sleep, you go into an anabolic phase. You build, you generate. So if you have had some damage to your vital organs during the day, when you're asleep, the anabolism comes in and then you are healed. And for little children who are still growing, you grow well. Good sleep helps you to relax and with mood stabilization. I told somebody that we are very unkind to patients in this hospital. A patient came with a stroke from Shendam to emergency casualty. I was scandalized when I was seeing the patient in clinic. The patient had come to Jos. A doctor saw him and said, "Go, you don't have an emergency. I only deal with emergencies here, go to the clinic." No quarrels, but I would expect to see a clacking and a walk up. You just tell a patient, "Go, you don't have an emergency." At the risk of my friends in the nursing profession fighting me, a lot of it happens on the ward. Patient is crying, "I beg, no disturb me." Doctor comes on ward round. "Please continue. When you finish, just write whatever you like. We will look at the file." Such a chap may not have slept well, because if he slept well, he will be relaxed and the mood will be stabilized. The mood instability we see all over the place. Go to records. People talk to people as if they are no human beings. It's no good. We need to think back and maybe start to sleep well. Good sleep helps in decision making. See, man, decision making. Dr. Manaki gave his experience. Be sure you sleep well, then your decision will be right. Good sleep helps in emotional intelligence. I tell you something. When we were in the University of Ibadan, we had vice chancellors. One, when we don't have water, he will come and say, "My boys, I'm told you haven't had water for 2 days. What's the problem? How have you been coping?" "Okay, don't worry. I know it's some stress. You may take your bucket to Obadam. We are working on it. Maybe in 24 hours, you will have water." Hey, good VC. Another VC. "What is the problem? Only 2 days. The people in the village, do they have water?" That vice chancellor does not have emotional intelligence, because if you do that to youngsters, they are going to fight you. And this is happening because one VC sleeps well, another one does not. Emotional intelligence. Cognitive function. You come to work, you are a consultant, MOPD is crowded. How calmly can you come up, call Metron? Please don't lose your patience. Okay, patients, we are going to see everybody. What we want is cooperation. They have said you should go outside, you stay outside, you will be called in. Somebody is calm. Somebody is applying cognitive function. And if that happens, he will be more productive and he will be creative. I tell Mr. Miri, I say, any day I come to MOPD and I don't see you, I will stop working. Because with him there, things are so organized, he is calm, he tells patients, just wait, if not this man, you will be seen. If you make trouble, that's where your problem will start, and things go well. Sleep serves important function. And wait for this one, it boosts immunity and fights disease. If you sleep well, you are less likely to come down with illnesses. Now, sleep has been described as the ultimate performance enhancer. So, when athletes go to dope because they want to do well, they miss the point. All you need to do is train hard, sleep well the day before your event, and you will fly. If you go doping, of course, you won't do well. Of course, if you do like Nigerian contingent to Moscow Olympics, who will be at a discotheque spinning till 3 a.m. There's no way you can hit the track the next day and do anything. You must sleep well. So if we are going to truly thrive, we must begin with sleep, because that is the life of well-being. Sleep impacts various diseases. Psychiatric, Dr. Bindo has talked about cardiovascular, respiratory, endocrine, malignancy, gastrointestinal, etc. Now, some of these aspects have been taken by my colleagues. Now, sleep starts light and gets deeper in what is called the non-REM phase. It alternates in cycles with another phase, the REM phase. People have talked about it, during which we are somewhat active and dreaming. The non-REM happens earlier at night and the REM towards waking in the morning. This is called the sleep architecture that Dr. Osai talked about, and it could be influenced by genetics, environment, gender, race, socioeconomic status, and culture. Some of these are modifiable, most of which is environment. Now, I shall take us through environmental issues affecting sleep and how you can get yourself a good sleep. So, what is sleep? Sleep is a state of unconsciousness in which the brain responds more to internal than external stimuli. There is music around, you don't hear. They are fighting outside, you don't hear, external stimuli. You have a full bladder, you wake up, internal stimulus. So sleep, you are unconscious, responding only to internal stimulus and not to external stimulus. Now, how much is enough? Sleep duration varies. For some, 3 to 5 hours, Dr. Madaki talked about it, of good quality sleep. And for some, 6 to 8 hours is considered ideal. But what is important, like Dr. Bindo talked about, is not necessarily quantity but quality. 3 hours restful sleep may be enough. For some people, you may need longer, and somebody has said, the longer you sleep beyond days, they come to work, everything is disgusting. They are irritable, they are shouting at everybody, they are easily frustrated, they are depressed, they are anxious, they are defiant. I hope our union leaders are sleeping well, because many of them perform poorly with memory and the executive function. And of course, if you don't sleep well, you are exposed to various diseases like hypertension, diabetes, obesity, stroke, myocardial infarction, dementia. Now, knowledge of a problem is halfway towards its solution. Therefore, since nurturing or caring for our lives depends on sleeping well, and we now know how we improve our sleep. First, environment. Where do we sleep? Very important. Do you sleep in a detached house where you determine what noise you get and what noise you don't get? Do you live in a shared block of flats where you want to sleep and your neighbor is having a boogie down? Environment, very important. Housing, neighborhood, and ambient, they matter very much. Your bedroom, which is where you sleep. Do you have a separate bedroom or you sleep in the parlor? because of overcrowding. If you do, anybody that passes, you wake up, isn't it? You can't see you're sleeping well. So your bedroom, it must be warm. Not cold, not hot. If it is cold, you're shivering, you can't sleep. If it is hot, you're sleeping, you can't sleep. So you have to ensure that your bedroom is warm. Your bedroom should be dark. No light. That is what nature prescribes. Sleep time, darkness falls. Wake time, light comes. So if you sleep in a bedroom, be sure that bedtime is lights out time. If you live in a place where light streams in from outside, you have to heavily curtain the windows of your bedroom so that when you go in and turn off the light, it is dark. No noise. Traffic noise, where do you live? Do you live close to the roadside? Neighbors. Are your neighbors noisy? Are they fighting? You go kill me today, you no go kill me today. There's no way you can sleep. What gadgets do you have? In your bedroom, Dr. Madaki said 2 things. Sleep and sex. And I used to say that I was guilty because I was reading in my bedroom. But when I learned that it was wrong, I apologized to my wife. I'm back in my books again. So, gadgets. In the tropics, insects. You must insect-proof your bedroom. If you have everything right and mosquitoes are flying all over, you can't sleep. If your bed is reading with bed bugs, you can't sleep. So you have to pay attention to those things. No electronic distractions. The bedtime is not WhatsApp time. It's not let me check my email time. It's not let me watch this late night movie time. You won't be able to sleep. And you must make your bed comfortable. He talked about mattresses. Very important. Second, lifestyle. What are the do's that will enable you to sleep well? It is good to have a fixed bedtime. Remember that we're talking about biology. We're talking about rhythm. We're talking about cycles. If you go to bed at different times, it won't synchronize. But if you go to bed at particular times, when that time is coming, your brain is shutting down, and then it is time to sleep. Cool, soothing music. And it must be cool, and it must be soothing. Otherwise, you won't be able to sleep. Warm bath. Dr. Madaki broached the subject. But, of course, do you have water? Do you have electricity to warm it? Now, meditation allows you to cool off and shut down and let go. Dr. Samede talked about reading the Bible because that's the time the devil, who doesn't want you to know the word of God, will force you to sleep. But as a Catholic Christian, I found something very, very useful: the rosary. I challenge any Catholic here who has difficulty with sleeping, say your rosary at bedtime and you won't complain about sleeplessness again. Now, what are the don'ts? Don't eat late at night. Don't snack at night. Don't suddenly remember that ice cream in the fridge and go for it. Bedtime, shut down. Ensure that meals come at least 4 hours earlier. Most of the sleeplessness we have is because we eat late. Now, you want to sleep when metabolism is shutting down, but you have put fuel in the body to get it to work. It won't work. So, don't eat late. Don't use caffeine in any form later than 6 hours before sleep. Dr. Bindo enjoys the aroma, but of course, if he overdoses it, he won't sleep. Don't use alcohol later than 4 hours before bedtime. What alcohol does, it makes you drowsy. It gives you shallow, fragmented sleep. You wake in the morning, you are not well rested. And of course, the morning hangover that we all talk about. But you've taken alcohol, all right, you're a bit drowsy, you go to bed, poor quality sleep. You wake in the morning, you are irritable, you're fighting everybody, you're craving the substance again. So don't use alcohol. Avoid food that you may be sensitive to. You eat yellow, you don't feel quite right. You eat fried food, you don't feel quite right. Don't take those things at bedtime because you won't sleep well. Don't have siesta for longer than an hour. It eats into sleeping time. If you sleep during the day, don't complain that you are having sleeping difficulty at night. You may just be playing catch up. Now, don't use prescription drugs late. Professor Koli talked about taking drugs. Don't use prescription drugs late unless the doctor has specified nocte or bedtime. If he tells you morning, afternoon, night, let your night be with your evening meal, which from what we are saying should come earlier. It is only those drugs that are bedtime that you should wait to the time you are going to bed to take in the mouth. Otherwise, your sleep won't be good. Don't watch TV in bed. Don't use electronic devices like phones and computers. Don't read in bed unless the material is soft. Don't read exciting things. Don't read things that will annoy you. Don't read things that you can't stop reading. You want to see what the next chapter is, you won't be able to sleep. And of course, don't smoke in bed. Apart from the fire hazard, of course, when you're smoking, you're waking your system up and you just can't be able to sleep. If you pay attention to these and your sleep improves, you will get the attendant benefits and all those things we talked about. Emotional intelligence, creativity, productivity, emotional stability will be yours the next day, and that is my prayer for everybody here, and I thank you very much. The next stage, because we wanted this to be as interactive as possible, is 15 minutes of exchange, comments.
I want to thank the presenters for a wonderful presentation.
Sorry, yeah, go ahead.
My question is, the risk of developing sleep disorder, does it have anything to do with the stage of sleep from which you regularly wake up? You know, you said you could wake up at the NREM or REM stage. If that is the case, do we have control over at what stage you wake up?
And sleeping, even at daytime, some once they sit, they are comfortable, they go off. Is it a disease? If it is, what do you call it? Does it have a treatment? You see some individuals walking and sleeping, and some once they sit and they are comfortable, they go off at any point in time. So how do you handle that? How do you treat it? Or is there any way you can help the person minimize this? Thank you.
Okay. I've heard people say that they didn't eat in the night, they can't sleep. And they can wake up as early as 2 a.m., 1 a.m., and they must eat before the sleep will come. What do you have to say about that?
REM sleep. REM sleep improves declarative memory and worsens procedural memory. And that the converse is also true. So there appears to be a crossroad there. It has an advantage with improvement in procedural memory, but also decreases. Declarative memory is improved, but procedural memory is worsened. So I don't know Dr. Osai's take on that.
We talk about dream.
Yes, dream.
In the course of this seminar.
Yes.
Yes, but I have a class of people, I know people who dream very vivid dreams, and it's like a prediction. Later, this will happen. Exactly. Not that it happened before. You say it's their consciousness and they are dreaming about it. They dream about it and it's like, what is this? And 1 week, 1 month, 3 months, 1 year's time,
It will happen.
What is the answer to that? How does that come about?
We'll leave that to...
You're asking whether sleep disorder has to do with time when somebody is woken up from sleep. What I said about the time of being woken up from sleep has to do with remembering the dream that you had or not remembering the dream. Okay? I said those that wake up, woken up during REM stage of sleep, if they are dreaming at that time, they'll be able to remember. Okay, those that are woken up at no REM stage of sleep, if they were dreaming, they will not be able to remember. Now, the state at which you are woken up does not have anything to do with development of sleep disorder. Now, the development of sleep disorder has to do with the amount of sleep that you had
the quality of sleep, and the timing. Those are the things that can make somebody to develop sleep disorder. So if the amount is not adequate, then there's a problem. The quality of sleep that the person always has is not adequate, then will develop sleep disorder. And then if you go to sleep at varying time, you are disturbing the sleep-wake cycle, the circadian rhythm, and so that will make the person to develop sleep disorder. Now, sleep and memory. The memory function of sleep is actually subserved by 3 different aspects of sleep. REM stage of sleep helps memory. Then the transition between REM and non-REM also helps memory. So that is why it is proper for you to experience about 4 to 6 of those alternating cycles to consolidate memory. And then, of course, the deep sleep stage, that is stage 3, or stage 3 and 4 now, also helps memory. So it is not really specific whether procedural or any other kind of memory. But cumulatively, all of these sequences should occur during a good night's sleep for you to have good memory. Thank you.
You need to deal with the problem, which is the disease in question is trypanosomiasis. And interestingly, I read in one of my books that people who have trypanosomiasis tend to experience some spiritual hallucinations. They wake up and tell you that God has spoken to them to go and become the governor of Plateau State. So it's a sickness, it's not part of what we are saying, and it has to be dealt with. Then about people who just can't but sleep. There's something called hypersomnolence. Okay, when sleep is excess. Okay, so it's an illness, but you also need to be a bit careful. When there is nothing to do, most people will knock off. Most people will knock off, and that won't be because there's a problem. But where it is worrisome is, for instance, a doctor comes to work, he is in his clinic and he's sleeping. But if I come into MOPD and there's a fight outside and I am so uncaring that I don't want to know what is happening, and I say, matron, sort out yourself. When you're ready, give me a patient. For those 15-30 minutes of not doing anything, I may find myself knocking off. But it will be abnormal if there are patients lining up and I'm sleeping. So yes, there could be a problem, but it may also be that there is nothing to worry about. And of course, you know that is not an exciting situation, because life is about challenges, overcoming challenges, confronting challenges, appraising them. So if nothing matters to you, people like there was a governor in Lagos State, and they say Baba goes slow, nothing. I mean, if there are potholes, no problem. If workers haven't had salaries, no problem. That mental attitude is not correct. Those are the people who will just sit and sleep. But of course, the DA cannot go to his office and sleep. If that happens, something is wrong. Because coming every day, he is thinking, what problem was there yesterday? The people I gave instructions, how much of it have they done? What can I do? So you just can't sleep. Okay? But of course, it's all about a balance. Dr. Sai talks about several cycles of non-REM and REM. When you get enough consolidated sleep, you are well rested, there is no problem. If you don't, there is a problem.
Stimulus. Nobody expects you to go to bed without food. If you do, certainly hunger will wake you up. If, for example, you usually take your meal and then you still feel like waking in the night to eat, those are the people who advise you to take a snack close to bedtime, but not too close. I mean, depending on what snack you are taking. A light snack, 2 hours to sleep time, is okay. It will correct some of those things. But of course, if you go to sleep empty stomach, you will wake up, because you will respond to that internal stimulus, which is a way the body uses to make sure that there is enough nutrient for the body. Okay?
And the conscious part of the mind that we are aware of is quite small. And the bigger chunk of that part of the mind we do not know. We all know that dream occurs all through the night. And I would want to go towards being spiritual now. If your eyes of understanding is enlightened, you probably may remember some of those things. If you have an expectation and it comes to pass, because what we do at times in dream is probably to reenact some of the challenges we had in the course of the day, probably to complete some of the tasks we are not able to complete. The mind handles it. The mind has a way of, so that the mind can rest. And until such issues are handled, and that's why at times your uncles, I think what talk was something about it, your uncle has been a very bad person to you and all that, and you were thinking about it. In the course of the night, you may dream about you being with him and slapping him. And slapping him helps you in handling that situation, because you can't confront him during the day, or else everybody will curse you. So somehow the mind helps. And if you have expectations, if you have some English, some people may just probably be sick, and something tells you probably the person may be likely to die. And in the course of doing the dream about the person going, the mind helps handle it and probably make the way go. But there is a lot that we don't understand about the mind.
With delay in coming, I'm sure we'll find something. So we'll take this next cycle and okay, we'll take just these three and then we'll come close, okay?
I'm not the medical personnel, but I'm from Mitu. On a lighter note, I went for medicals, and then I was a big at this. And then the man that was attending to me, he said, "Boy, you look so big. You need to work on your side, on your size." Then I look at the person who was talking to me. It was twice my size. So I said to my mind, "Brother, you need it more than I do." All right, I was quite big, and Professor Okeahialam was one of the guys one of the people that actually talked to me, and I worked on my size. Right now, I run a fitness club in the area, in the estate I stay in, Federal Locals. One of the things I discovered, I have like 3 testimonies of some women or some people who had difficulties with sleeping, and they do come out for exercises, and then with a short training, say 2, 3, 6 months, they discover that they sleep well. They sleep well. So I just want to ask the question, what is the relationship between the body weight, fitness, and sleep? What are the relationship?
Like my brother said, I'm not from the medical field. I'm actually a counseling psychologist. Invited by one of you on this topic of sleep. My plea is, these days we encourage interdisciplinary approach to problem solving. I did hear somebody say that we're going to form a club or a union or a body. My plea is that please remember those of us in the psychosocial aspect of this treatment of sleep. Because I've heard of depression, mood altering, emotional intelligence, irritability, anger, and strained social relationship. This fall within the domain of those of us who are not in the medical. So do remember us. That's just my plea. Thank you.
Of sleep during the night. Distraction.
Yes.
Like me, I do have every day, every night. That is so. I do have 3 times waking up and doing something. When I do something, I went back and sleep. And now, we are talking of if one did not complete sleeping hours, and then the life will get dropped.
Most of our patients with high blood pressure.
You say this is what?
Is dream a vision?
Is dream a vision?
Or vision is dream? I don't know. Then the second question is, most of our patients with hypertension, we normally ask them to take drugs at night. So at what stage of the sleep that they can detect, they can have the hypertension? Thank you very much.
Looking at the circadian system and the natural way sleep should come with darkness. But I find out that some people eat and just a few minutes after eating, they fall asleep. So what's the relationship between what is happening in the system, in the neural system, and the eating, the postprandial sedation that comes up? Thank you.
Okay.
I really thank God for the opportunity given to me to attend this very wonderful lecture by doctors. For the first time, I'm hearing a wonderful lectures which sometimes touch part of my work as a pastor. The director admins invited me to be here. So I'm really blessed with this lecture. If you will form a group like this or having a department like this, I think will help. And we want to also advise that it's good when you gather patients, you teach them this, because it helps a lot. My question is, you made mention type of mattresses. I don't know whether they have lifespan. That even if it is still good, one will just have to.
Yes, okay, I will answer.
Yes. Discard it, even if it's still good. Number two. Question number two. The second question is, you made mentions of the posture of sleeping, and you also mentioned the best. Which sometimes other people will find it difficult to adopt the best one, maybe because of their health issues. Sometimes when people are sleeping, you hear them snoring. And what is the cause of that one? At what posture would someone adopt for someone to snoring?
Questions. The first question I want to attend to was a question that was asked by Dr. Dachon. We're asking at what stage of sleep does one have BP? That is at the stage of the rapid eye movements of sleep, because you have fluctuations in blood pressure, autonomic dysfunctions can occur at that time. So you can have swinging blood pressures. And that is usually the time that most patients will have a stroke in the early hours of the mornings, when the rapid eye movement stage of sleep is longer than at the beginning of sleep. The other question is eating and sleeping. Now, we have said in our advice on modification, lifestyle modification, we talked about not eating heavy food close to bedtime. Now, we should also understand the fact that in normal physiology, even during the daytime, when you eat heavy food, what happens is there's a lot of pulling of blood into the splanchnic system. All right, so diverting blood away from other active areas in the brain, the vital organs of the body, everything goes towards the intestine. So the muscles are deprived of blood at that point in time. So there's a transient weakness. Okay, so the person can easily go to sleep at that time. But that is not to say that the sleep is going to be a refreshed one. Okay, goes to sleep and it can be, depending on what the person has eaten, it's not something that is very good for the system. Of course, there's going to be, disturbance during the night and then transient waking up and all of those things. So you wake up in the morning not refreshed. So it's actually better to take a very light snack 90 minutes before bedtime and then take a warm bath, all right, and avoid eating very close to the time that you're going to go to sleep. BMI and sleep. I think the reason for this is not far-fetched. When somebody is very fat, you also have a lot of fat within the pharynx, okay, the throat, where the airway is. And so when he's sleeping, especially when he does not assume a good posture during sleep, if he assumes, lying on the back, it's very easy when you are relaxed during the non-rapid eye movement of the stage of sleep. That is the deep stage of sleep. The pharynx and the tongue is going to fall back against the airway and is not going to be able to breathe at that time. So he keeps having micro-arousals. He wakes up several times in the night, goes to sleep because of hypoxia in the brain and all of those things. So he wakes up in the morning not feeling very refreshed. Of course, some of them will not even know the reason why they wake up intermittently in the night. As much as possible, we should do things that will promote good sleep hygiene and then avoid waking up severally in the night for reasons that we have discussed so far. Thank you.
Well, the outright answer is the fact that vision is not a regular trait. Visions occur more often than not in awake state, or when the there's a little disturbance with sensitivity. But we need to also differentiate that from people hearing voices and seeing things. People who are ill can actually see things, and a lot of I beg to apologize to the church and the church community. Quite a number of people that are ill are actually within the community, and they tend to see things, and until what they are seeing is no longer in keeping with the vision of the church, that they probably discover that it's actually an illness. So we need to differentiate that. But dream occurs in sleep, and vision is in clear, is not in sleep. It's probably more or less when people are awake, and we need to differentiate that from people hallucinating. Thank you very much.
Okay, weight management and good sleep. When you exercise, you increase your cardiorespiratory fitness. Remember one of the themes? Sleep soundly, live well. Okay? So when you're fit, you tend to sleep better. Remember also we talked about exercises. That you should exercise, it helps you to sleep. Because when you exercise, if you're used to exercising, at the end, when you cool off, it is a calming experience. So when they start exercising, they improve their cardiorespiratory fitness, they are calmer, and they tend to sleep well. They deal better with their weight. Good sleep, good breathing. When their weight is better dealt with, all the fat around the neck that block the airway is cleared, and they tend to sleep better. So there's a lot to benefit by what you're doing. And of course, it is no surprise that they begin to sleep well. For the sake of time, I don't need to repeat. Dr. Sai has answered Metron's question, and then the hypertensives, you've been told why it happens during the REM sleep, because that is the period of cardiac autonomic instability, and that is why you worry about that. But we can keep talking, but we must end this session. So Dr. Madaki will answer his question protocoly, and then we'll close. Okay, you don't have any questions? No question.
All right, thank you very much. I think Prof. raised there with the issue of exercise, but remember that part of the things why exercise is very helpful is because it addresses stress. People who do exercise regularly are much more happier, and stress itself is a key point in sleep disorder. So people who are stressed don't sleep well. So that alone contributes to even sleeping.
But coming from all the questions that I've been hearing, one or two things come to mind. They say a small snack at night. How do you define a small snack? Some people can see for them pounded yam is a snack. I'm serious, pounded yam is a snack. Some people will see that night, this Habatan home, ice cream is a snack in the night. So that brings us to what I want to say finally, that this problem, that is what I've been emphasizing since I spoke, that this problem of sleep is not a simple problem. And I think we have just set the basis for our subsequent discussion, subsequent action, and subsequent activities. What we have just learned here is that there's a lot more to be said about sleep. I came here, I was excited. At one point in time in my life, I thought I was having a lot of stress, and I was giving lecture in stress. We went for a seminar like this in the process of giving lectures in stress, and that was when I found my answer to stress in the process of giving the lectures. So this time I was so happy. I said, aha, at last I will find the answer to my sleep problem. When I come to this lecture, I will get the answer. All these things that I've been doing. But I'm sorry to tell you about that. As I'm standing here now, I'm more confused than when I came. I don't know what to do or what not to do. I still exercise in spite of my back pain. I find out that the days I exercise, that is the day I cannot sleep. I eat. The day I don't eat, hunger, if I don't eat, I will not sleep. So I shift my eating a bit. I shift it for as much as I can shift it. Because if I eat too early, I will be hungry in the night. And what is a snack? Take one cracker and one. That's not Oyibo now. That's not Africa. Take cracker and biscuits so that you will sleep. So the thing is more complex than we see. I am not seeing the answer to my problem because I've tried almost everything. This is not for me to consumption. I think this is just for us. I've tried almost everything. But what I can say to myself is that we will keep trying. We will try amongst ourselves. It's just that me, I don't know how to hide my problems. I'm sure there are people here who fall in the same group as myself. So we keep trying all of these issues and we keep talking about them. And I think as we progress, we begin to get answers. As again, like I said earlier, the development of the sleep lab is not out of place. I volunteer myself as the first guinea pig when we buy the machine. And I think that will help us a long way. And I want to thank Professor Okeahialam for spearheading this beautiful seminar. And I don't want this to be like other groups that this time, 17th of March next year, walk on wall, or February, Valentine's Day, we start rushing and thinking of what to do about sleep. Let us hit the ground running and keep talking about it and keep working towards achieving new sleep practices and sleep.
It is because it's been found that people who sleep short, they are not well rested the next day. All the stress, all the disorganization. So they get all the high blood pressure, they get all the diabetes, they get all the stroke, they get all the heart attacks. So that is the link, and there is no question about it. But remember also that we said that it is variable. Some people sleep 3 hours, good quality sleep, and they are well. Some people sleep 6 hours, fragmented sleep, they are not well. The importance is quality and quantity, and not quantity alone. We are coming to a close, and the CMA will give a vote of thanks and whatever other things he wishes to say, one of which may include promising Professor Colin that the sleep lab will come next month. We'll wait for him to say that.
And truly for donating us sleep. He gave us sleep. But he doesn't sleep. My Lord neither slumbers nor sleeps. But he gives us sleep. And he gives us a very good sleep. It is our own probably pursuit that sometimes deny us, but God gives us a good sleep. So we thank him, because there are people who will even meet him, take sleeping tablets, and yet they will not be able to sleep. So he gives sleep to those who he will give them. So we thank the Almighty God. We thank the international community for making this day a possibility, a World Sleep Day, so that we can reflect on this great gift of God. Okay? We ignore it, and some of us in pursuit of life, we throw away sleep. When they were talking, you see, when he was asking how many hours do you sleep, I don't know how many hours I sleep. The only thing I know when I wake up, because I have to do devotion. But when I go to bed, I don't know. Sometimes very scant. But God has given us sleep. And they want us to reflect on these gifts. I think that it's a gift that comes from Him. We thank all those people who work behind the scene to make this a reality. Professor Okeahialam, Dr. Madaki, and the resource persons. Truly, I thank all of you for coming around. Because if the hall were empty, it would have really been a disappointment. DA left here, they went working on this and many other things. Okay? So we thank you all.
thank the hospital leadership. I know how much discussion we had, even yesterday or the day before. He was in CMD's office and I was there. We were talking about this. Even yesterday, Dr. Madaki was there. You know, for creating the enabling environment so that we can do this. Truly, how we wish we had this thing regularly. This clinical meetings or progress. We can have. And one of the, antidote of our frustration and our backwardness and suffering is poor sleep. In fact, somebody made mention of WhatsApp now. Do you know, with the coming of all this internet and WhatsApp, I don't know, they didn't mention that one. Sex too has dropped. A country has now set up a Ministry of Sex Affairs. Have we heard about it? And trying to reward people so that they will have more sex and have more children. Because people are no longer willing to sleep. Okay? So, our frustration in life can also be taken care of. No wonder he said, come and take my yoke. It's light. Okay? And I will give you what? Rest. So, only people who cannot rest, who cannot do what? Sleep. We hope that we'll work on that. Dear and myself are here. Okay? We will see, we will start putting your sleep lab on the table. And hopefully one day, the vision of a sleep lab will also come to be a reality. It all starts with a vision. Okay? It all starts with a vision. And if we do things that can bring our thinking or make our thinking right. For example now, in management, thinking of organizing a clinical meeting, or how can you think of resolving strike issue? Okay? The hospital is partially working because of strike. So your attention is gone in that direction. You are struggling on how to get light. You are struggling on how to get water. You are struggling on how to get laboratories, including the sleep lab. So many things. But those things will not deter us. And hopefully, God will see us through. So thank you very much. I pray that we will be able to get less confused and adopt healthy lifestyles, including sleep, on our program and on daily basis. Thank you.
Thank you, Dr. Madaki. It's been a long day. We have, by the grace of God, overcome, because all the, in worry, they call them winches, all the winches that tried winches to stop us, they didn't succeed. So it's time to close and to give glory and honor back to God. So the pastor visitor will give us a closing short prayer.
Our help in ages past, you are our hope for years to come. We are grateful to you for having these hours to hear from these your children that you have blessed them with divine wisdom to help humanity to live a healthy life. This afternoon, because you have said it, Psalms 127 verse 2, you are God who gives sleeps, have received. We pray that God, those who are finding it difficult, help them to sleep well. Those that you have used them as your instruments to bless us this afternoon, educate them more. We thank you. We are leaving those who will live to continue with their work And those of us that have come to receive some of this blessing, we'll be going back and pray you take each of us home safely. Bless the hospital. Bless doctors and nurses and all workers.
Thank you. Thank you very much. You're all welcome. And God be with you all. Thank you very much. All right.